Good afternoon. I'm Mandy Cohen. I'm Secretary of the Department of Health and Human Services, and today I'm joined by Director of Emergency Management, Mike Sprayberry. Monica McGee is our American Sign Language interpreter, and Jackie and Jasmine Matevier are our Spanish interpreters. As far as today's numbers, as of this morning, there were 9,853 new cases reported today. 3,990 people are currently hospitalized right now across North Carolina, and sadly, there have been 7,825 deaths. We continue to accelerate vaccinations across the state. In the past 7 days, hospitals and local health departments have increased the number of vaccinations given by 133% compared to the 7 days before that. Today, we reported that providers have given 326,198 vaccinations. That's 326,198 vaccinations. But remember, there's also a data lag, and total vaccinations allocated to our state include 160,000 for our long-term care facilities, as well as vaccines that were allocated to our state for the week but have not actually yet been received by our vaccine providers. We will continue to offer support to our local health departments and hospitals to get shots in arms faster. On Tuesday, the governor shared that in the coming week, we will have large community vaccination events in 13 counties. And as of today, that's expanded to be in 23 counties spanning the entire state from the mountains to the coast. Partners were selected based on their ability to administer a large number of vaccine doses or to provide access to vaccines to marginalized communities. I want to thank Emergency Management and the National Guard for their support in these efforts. Additionally, today, Honeywell, Atrium Health, Tepper Sports and Entertainment, who own the Panthers, and the Charlotte Motor Speedway announced a unique public-private partnership to support the goal of 1 million COVID-19 vaccinations by July 4th of 2021. They plan to vaccinate as many people as quickly and efficiently as possible with a focus on our underserved communities. Governor Cooper is committed to partnering with businesses and healthcare providers to get vaccines in people's arms as quickly and as equitably as possible. Because the supply of vaccine is limited, we have prioritized vaccinating people who are at the highest risk of being hospitalized or dying, and those at highest risk for exposure. Starting today, to align with the new federal priorities and to facilitate speed of vaccinations, vaccine providers that are ready to can expand to now vaccinate all healthcare workers and anyone who is 65 years and older. We continue to move through our vaccination groups, giving local providers the flexibility to move to the next priority group as they complete the previous ones and have vaccine available. So to reiterate, providers can now vaccinate all healthcare workers and those ages 65 and over. Next will be our frontline essential workers, followed by adults with high risk of exposure and increased risk of serious illness, and then any North Carolinians. We know that counties are in various stages as they deal with new cases and vaccinations. These factors, along with limited supply, means that many folks will have to wait before vaccine is available for them. We're working hard to ensure that North Carolinians are informed about the importance of getting vaccinated. Understandably, many people still have concerns. It can be hard to know what is true and what can be trusted. We are here to provide you with the honest, factual information about vaccines. First, there are currently only 2 COVID-19 vaccines. Everyone who gets the Pfizer vaccine, no matter race, ethnicity, and age, gender, they all get the same vaccine. This is the same thing that's true for the Moderna vaccine. Scientists had a head start in developing the vaccines. The vaccines use a method that researchers have been studying and working with for decades. All vaccines are tested for safety and effectiveness before they're authorized. More than 70,000 people volunteered in clinical trials for the vaccines to make sure they were safe and worked to prevent COVID-19. Results from those research trials showed that the vaccines are 95% effective in preventing COVID-19. There were no serious safety concerns noted in those clinical trials. You may have temporary reactions like a sore arm, headache, or feeling tired and achy for a day or two after receiving the vaccine. You cannot get COVID-19 from the vaccine. Vaccines use mRNA to give the cells in your body the instructions to make a protein that safely teaches your body how to make antibodies to fight the real COVID-19. Your body destroys that mRNA and gets rid of it. It doesn't stay, nor does it alter any DNA in your body. The only other ingredients in the vaccine are salt, sugar, and fat. The vaccines do not contain eggs, preservatives, fetal tissue, stem cells, mercury, microchips, or any other ingredients. There are no data that show vaccines negatively impact your ability to get pregnant in the future. You won't be fully immune to COVID-19 until 1 to 2 weeks after your second vaccine. Vaccines are the best way to end this pandemic and save lives. It will take time for everyone who wants a COVID-19 vaccination to get one. And I encourage everyone to go to yourshotnc.gov to get accurate information about COVID-19 vaccine development, testing, safety, and reactions. It's your spot for reliable information. Now, I've spent most of my time this afternoon talking about vaccines, but unfortunately, we know supplies are still very limited. Today, we face the immediate and dangerous situation of extremely high numbers of people having COVID here in North Carolina and record numbers of people in the hospital. The percent of tests that were positive are triple of that where we want to be, and there is a new and much more contagious variant of COVID-19 in our country. My directive remains in place. Stay home. Only leave home for essential activities like work, school, or to meet healthcare needs. If you must leave home or be with other people who you don't live with, wear a mask all the time. Stay at least 6 feet apart and wash your hands often. Keep doing those 3 W's so we can slow this virus down while we get everyone a spot to get their shot. With that, I will turn it over to Director Mike Sprayberry for a few remarks.
Thank you, Madam Secretary, and thank you for your continued outstanding leadership. Good afternoon, everybody. Today is day 311 of the State Emergency Response Team activation for the COVID-19 response. Before I begin my update, the State Emergency Response Team gives a hearty and heartfelt thank you to our local partners who are making it happen with their grit, expertise, and strong partnership. The health departments, emergency management agencies, PSAPs, healthcare organizations, firefighters, emergency services, law enforcement, and all of the other disciplines that are tirelessly working each and every day to protect all North Carolinians. We know that you have been in the trenches from the very beginning, fighting relentlessly to mitigate the spread of this virus. Please know that we appreciate you so much and are here to support you. The first National Guard team supporting vaccination sites began work this week. So far, 24 National Guard personnel are on scene assisting Albemarle Regional Health Services and the Forsyth County Health Department, with plans for over 250 to be at work across the state by the end of next week. We have new requests from counties for vaccination support coming in every day. Keep them coming. This support is being provided with a mix of National Guard soldiers and airmen. Some are healthcare workers like medics or nurses who are giving vaccinations. Others are assisting with administrative tasks like vaccine data entry or with logistics support. I want to note that the other National Guard members are continuing to provide vital support to food banks and rapid COVID testing sites across the state. We're also coordinating volunteers who can support vaccination sites statewide. Organizations like our outstanding Civil Air Patrol and Community Emergency Response teams are already lending a hand. If you would like to register as a volunteer to help at vaccination sites or medical facilities, there is a website set up for that. Visit terms.ncem.org. That's TERMS, terms.ncem.org. You will go into a pool of volunteers to be screened, and if approved, you could be called on to assist at a vaccination site or medical facility in your area. I want to note that the National Guard support for COVID-19 is separate from the mobilization that Governor Cooper announced yesterday, with 550 additional members activated to support security operations here in North Carolina and in our nation's capital related to the inaugural events. 350 of these troops will be on duty beginning this weekend in North Carolina, and 200 are headed to the National Capital Region, where they will join National Guard elements from other states in providing law enforcement support. In closing, let's encourage everyone to get the vaccine when your turn comes. It's safe and it's free. I'm sure looking forward to getting the shot when my turn comes. You have a spot, so take your shot. With viral spread at critical levels, it's more important now than ever to observe the 3 W's. Wear a face covering, wait at least 6 feet apart, and wash your hands often. That's wear, wait, and wash. And as always, don't forget to look out for your family, friends, and neighbors, to call your loved ones daily. With kindness and cooperation, we'll all get through this together as one team, one mission, and one family. Thank you, Madam Secretary.
Thank you, Director. And with that, we will take your questions.
Our first question today is from Will Michaels with WUNC Radio.
Hi, Dr. Cohen. Will Michaels at WUNC. Thanks for taking my question. Does the state intend to follow the recent guidance from the Trump administration not to hold back second doses of the vaccine?
Well, thanks for that question. So we are still awaiting exact details from the federal government about how they're going to be doing the release. Are they just releasing second doses? There's also some additional doses that they were holding back in case anything happened related to shipping or manufacturing. So we're still trying to understand exactly what is being released and when. What I want to make sure for our vaccinating providers is that they know that that second dose is going to be there so that they don't hold back on given first doses. What we've heard from a number of providers as we've done our work to understand what might be holding them back from getting all the vaccine out the door. Some were reporting back to us to say, I'm holding this for a second dose. And we had to sort of clarify, hey, here's how second doses are going to come to you. So we want to make sure we're understanding that process from the federal government to the state and then to our vaccine providers, because we don't want anything that will hold up having our vaccine providers feel like they can get out as many of those first doses as they can so that they have that second dose guaranteed to be there when they need it. So we're working through those details and still need to understand some of that from the federal government. Thanks.
We have a follow-up from Will Michaels, WUNC.
Thank you for that, Dr. Cohen. The other question I had was about direct caregivers of older adults. Do they fall into this category of healthcare workers, and if not, which phase of the vaccination do they fall into?
Well, I'll have to follow up with you to see whether or not they fall into the category of direct healthcare workers. So let us follow up with you on that.
Our next question is from Tina Terry with WSOC TV, Charlotte.
Good afternoon, Dr. Cohen. Thank you so much for doing this. Can you please share more information about the new high-throughput vaccination sites, particularly the one operated by Atrium Health in the Charlotte area? Will it operate as a drive-through vaccination clinic? And how will you provide medical staff at these sites? I know that's been a problem just in general, finding medical staff to deal with vaccinations as well as hospitalizations. Also, is this new public-private partnership involving Atrium Health part of that high-throughput vaccination plan, or is it something different?
Why don't I work backwards from your question? So I'll start with the announcement made that was a partnership between Honeywell, Atrium Health, Tepper Entertainment, and the Charlotte Motor Speedway is a new and separate addition to what we were already working through, which is some of these community-based high-throughput sites. So we're excited to have new private-public partnership coming together in the Charlotte area. And I know there's others that are in discussion for other parts of the state. So that is a new partnership. I know they are still working through the details and the logistics. Is it going to be drive-through? How is that staffing going to work? But I think that's why that partnership is fantastic. I know Honeywell, they work on logistics. Atrium has the clinical support. So I think that, and then our folks in the Panthers organization and Charlotte Motor Speedway have space, right? So I think that's the kinds of partnerships that we love to see coming together. For those high throughput sites that I mentioned that are now going to be in 23 counties across the state, those are being handled in a number of different ways. Some of them are being supported directly by some of our healthcare providers or our hospitals directly. And you heard Director Sprayberry talk about some of them are getting supported by the National Guard. So it's a mix of ways in which staffing is going to be supported. Sometimes it's from the health system or the local health department. Sometimes it's volunteers. Sometimes it's our National Guard. And it's going to take that whole approach, and we're going to need to use different approaches in different places in the state to make sure that we can have vaccine access points across our state that allow us to also get to that level of speed that we want. That is certainly top of mind, that sense of urgency of wanting to get shots into arms quickly. So we're grateful to all the many partners who are working in those 23 counties to get those high throughput sites. That's in addition to our hospitals and health departments that continue to do the work that they've been doing over the last number of weeks. Some of them have what I would also consider high throughput sites. They're doing drive-through vaccination sites or larger events. So I think each community is tailoring to the needs of what they see there on the ground, as well as what they have available in terms of space and staff and other. We're just trying to partner with them and support them with whatever needs that they have. Thanks.
Follow up from Tina Terry, WSOC.
Thank you, Dr. Cohen. One more question. Can you explain where the vaccine is coming from to operate these new throughput sites, high throughput sites? Is this coming from a surplus that the state has? I think some counties are concerned that the vaccine that could go to them will be sent to these new mass vaccination sites. Please provide clarity there.
So when the federal government does its allocation to our state every week, and then we at the state decide in turn where should we ship that vaccine to. And so we have data to help us understand how much vaccine is across our state and in the hands of our vaccine partners. And what we've been doing over the last week is trying to understand if folks are out of vaccine, which we can see in the data, or if they still have vaccine sitting there on the shelf, and how can we support them in getting that vaccine out as quickly as possible. So this next week of allocation and these higher throughput events came about because there are some who still have vaccine sitting on the shelf that they're working to get through, so they don't need new vaccine this week. We're able to take that that vaccine that may have gone to them in the past couple of weeks. We're able to use that and concentrate it in some of these higher throughput sites. We are asking all of our providers to give us very specific plans about how they are going to be able to get any vaccine we give them out in 7 days, right? We get shipments every 7 days or so, and we want to make sure that the shipments we're getting in are going to be able to get out into arms within those 7 days. And that's what we're working with our providers, asking them, how are they going to do that? How can we support them in being successful? We know some of them still have vaccine that is there, and we want to make sure over the next 7 days they get it out. For that additional vaccine that we have, we're putting it in those high throughput sites. Again, those who are able to articulate to us that they can scale up activities to get that vaccine out in the next 7 days.
Next question is from Jonah Kaplan with ABC 11.
Good afternoon, Dr. Cohen and Director Sprayberry. I'll concede that this is kind of a simple question. If I'm over 65 and I'm watching this, and now I learn I can go get the vaccine, what do I do next? What do I do now? Who do I call? Where do I go? Thanks very much.
Thanks, Jonah. Well, the first thing I would say is you can look on our website, yourspotyourshot.nc.gov. On that website, you'll see a list of vaccine providers by county. It'll list either local health departments or hospital systems, and it will also indicate these high throughput community-based vaccination sites. Then we'd encourage you to either call or get in touch with those vaccine providers in your area. You don't need to feel limited to those that are in your county, but it may be something that is close to your home that you're able to drive to and access. So I would go to yourspotyourshot.nc.gov. That'll give you the list of those vaccine providers as well as phone calls. Sometimes they have online systems that they are using for vaccine. Again, that would be indicated there, or you can call their main number and find out what their process is as well. Thanks.
Follow-up from Jonah Kaplan, ABC 11.
I appreciate that, Dr. Cohen. My next question is, what would it take for a vaccine clinic to happen at a place like Dorton Arena or at PNC Arena or some of these other large-scale places like the Raleigh Convention Center? We're seeing these happen in other states across the country. You just talked briefly about public-private partnership with the Charlotte Motor Speedway. So what needs to happen before we get into some of these bigger venues instead of just a hospital or health clinic? Thanks.
Thanks, Jonah. That's exactly the kinds of conversations we're having now to bring together those partners, both the space, the clinical expertise and staff, and then the logistical support. So I think we're working through that. I was so appreciative of the partnership that came together in the Charlotte area. I think we'll see that in other places around the state. I know that folks are in conversations in a number of ways. I do want to remind folks, though, that vaccine supply is limited. So when you think about high throughput events, remember, we're getting only about 120,000 new doses every week. Our goal is to get all of those doses out every week, and we certainly have a bit of ground to make up here. But when you think about those large-scale events, we still have very limited vaccine. So it's not going to be something that can run 24/7. We just don't have that amount of vaccine. So we're figuring out what is that appropriate scale, where should those locations be, how can we think about equity and accessing, making sure there's access points for our underserved communities. All those things are going into the discussions we're having, and we're very appreciative of all of the folks who are stepping up to the plate to help us execute this really, really important, goal of getting all North Carolinians vaccinated. Thanks.
Next question is from Adam Wagner with the News and Observer.
Hi, Secretary Cohen. Thank you for taking my question. I guess to start, just a point of clarification on the 45,000 doses. Are those coming from next week's allocation, or are they redistributed from this week? And then also with the high throughput sites, is the timing on that coincidental with the CDC's announcement that they could be reallocating vaccine if states can't get it out, or is this part of an effort to really kind of get up to speed to where North Carolina will be seeing the same amount of vaccine moving forward?
Thanks, Adam. I think we've all shared a sense of urgency of wanting to get vaccine into arms as quickly as possible. So this was already work that's been underway, and to bring together the logistics, the clinical, and the actual space to make sure that these kinds of things happen. As far as the 45,000 that you mentioned, that was what was arriving either yesterday or today, about that amount of vaccine. That's what we were talking about for going into the weekend and through the next week. Now we are working on the next allocation. We always move into that next allocation and are asking our providers, what else could you do beyond what you're doing already, and how can we scale up? So those conversations are ongoing, and we will continue to work to make sure that we are, as I said, getting the vaccine that we have here in our state out into arms as quickly as possible. Thanks.
Next question is from Caroline Hicks with WBTV in Charlotte.
Hi, thank you for taking my question. I wanted to ask, what will be the challenges and how will these different health departments and hospitals ramp up their efforts for this additional group of people 65 and older? How are you going to make sure that they're getting the allotments they need? Are the allotments going to be increasing for everyone, or how is this going to work to meet the demand of this new group of people?
Well, thanks, Carolyn. There's a couple of things. I'd break it down to how do we use the vaccine we already have in the state and use it efficiently and quickly? And then how are we thinking about the new vaccine that's coming to us going forward? So in terms of helping folks get the vaccine that they have now out and quickly as possible, there's a number of ways. Your director, Sprayberry, talk about the myriad of ways in which we're helping with staffing support to either hospitals or our local health departments to really help, whether it's back office help and data entry, answering phones, setting up vaccine events, doing crowd control, or doing the vaccinations themselves. So we're trying to offer whatever help they may need. And we're talking to every single site, because every single site has slightly different needs and that we could help with. And so we're trying to do that individually. Some sites aren't able to get the vaccine out, and what we're doing is trying to partner them with other places that are able to get it out quickly. So if they report back to us to say, look, we know we have vaccine here, we're not going to be able to get it out in the next 7 days, let's partner, right? So that's all the work we're trying to do to make sure that vaccine that is already here in the state gets out really quickly. Then the question is, how do we use the vaccine that comes to us once a week and use that process to drive some of this speed and efficiency? And that's where some of these higher throughput sites come from. But remember, it's a limited pool of vaccine that comes to us. So if we take vaccine and put it in these high throughput, it does mean that there will be less and in places that may be less efficient and less speedy at getting out the vaccine. We are focused on speed, but we are also focused on that equity and access piece. So we are trying to be intentional about thinking about locations for these high throughput sites, so we still maintain that geographic distribution of vaccine, as well as focus on our historically marginalized populations. Now, North Carolina, when we first were allocating vaccine, we were very intentional about getting it to every single county in North Carolina, all 100 counties, equal balance of doses across all the state, so there were access points everywhere. I think as we focus and learn about how we can improve speed, I think we're doing a mix of getting to that continued geographic distribution, as well as these high throughput sites. So that's what we're focused on going forward. Again, as we work to get the vaccine we have already in the state out, and then focus on what we can do with the new vaccine coming to us. Thank you.
Follow-up from Caroline Hicks at WBTV.
In Mecklenburg County, hospitals, health departments have said that they could not give the vaccine to more people than they're giving right now. Right now, the demand is higher than the allotment. So can they expect more of an allotment to handle this larger population, or are they just looking at booking out appointments further out?
It's a really important message. We have less vaccine in our state than the number of people who are eligible to get it at this moment. For those who are 65 years and older, you could get vaccine starting now, but that doesn't mean vaccine is available for you today or an appointment is available for you today. I think you just heard about the Mecklenburg area where they are going to be setting up additional sites with additional vaccinators, which means additional appointments. So there are going to be more that come online. But at the end of the day, there's a limited supply of vaccine, and it's going to take us some time to get everyone their spot in line to get their shot. We also want to remind folks that as things are limited right now, we want folks to work quickly with our partners. There are partners that still have vaccine available, and we want to help them get it out within the next 7 days. So if they need more vaccinators, we're willing to help them with that. If they need data entry, whatever they need to get the vaccine that they do have out. Certain places have gotten all their vaccine out and are working incredibly quickly and efficiently. Other places need our support, and that's what we're hoping to provide.
Next question is from Brian Anderson with Associated Press.
Hi, Dr. Cohen. Brian Anderson here with the AP.
I know this in the website, there's no mention of college students in the new guidance today, and they appear to be delisted. Are college students no longer prioritized for vaccination over the general public in the new plan? And how many, if any, COVID vaccine doses have been thrown away in the garbage can here in North Carolina due to spoilage?
So on our prioritization, Brian, we know we incorporated the feedback we got just 2 days ago from the federal government, but it was still focused on those key priorities that we've had all along, which is to vaccinate those who are at highest risk for severe outcomes from COVID. So certainly that is our older population and those with, as well as those at higher risk of exposure. And that's still what you see in our prioritization. But we also wanted to focus on simplicity and speed. We know that there's been more confusion that there needs to be, and so we are definitely hearing the message about simplicity and speed, and so that's why we're trying to really be clear. What we're vaccinating right now are folks who are all healthcare workers and those above the age 65 and older. So those are the folks who are getting vaccinated now. Next, we'll move on to our frontline essential workers. Then, as I said, we'll move on to adults with other adults with more more risk of severe illness, as well as those other workers with more exposure, and then everyone else in the population. I think the second question was about spoilage. Now, we haven't heard of any sites that have had issues where they have defrosted or left out of the freezer vaccinations, but we continue to reiterate the message that we don't want to see any vaccine wasted, and this is the kind of flexibility that our local providers need. Yes, we have a prioritization that we want folks to follow, but at the end of the day, we don't want vaccine to go to waste at all. We know that these vaccines are life-saving, and we want every single dose to be used.
Follow up from Brian Anderson with AP.
Just to make sure I'm understanding correctly, are college students no longer prioritized over the general public? I know the previous plan had them in phase 3 and then the general public in phase 4, but now it looks like there's no mention of college students. So I just wanted to get put a pin on that and make sure I'm clear on what the plan is for them.
Brian, in this updated prioritization, we are trying for simplicity and to really focus on the additional guidance we got from the federal government just a couple of days ago. So we are prioritizing those who are at highest risk of severe illness, those who are at highest risk from an exposure perspective, and really try to get to some simplicity there. So yes, that's right. We've simplified.
Next question is from Colleen Quigley with WNCN-TV.
Hey, good afternoon, Dr. Cohen. Thank you for taking my question. We're hearing from multiple counties that they're having issues with that CVMS system, logging onto it, and then also entering the numbers. They're afraid that's affecting their future allocations, and then also showing they've administered less vaccine than they actually have. Are you aware of this issue, and is anything being done to address it?
Thanks for that. We are hearing that folks are having some data entry issues, obviously by the fact that we've logged more than 300,000 doses. So the underlying system works, but we recognize that it takes effort to put the data into the system, and that means people and time, and that's what we want to be here to help with. So we have offered to folks who are doing these vaccination efforts, if we can help with data entry, we want to do that, because we don't want folks to have their allocation suffer because they can't get the data into our system. But the data in our system is how we need to make decisions about things going forward. We have heard about a couple of folks who are a bit behind on data, and we are making sure not to have that impact their future allocations, because again, we're focused on just getting vaccines into arms, but that capturing of the data is really important, because it's really our tool to have visibility to know what's happening on the ground, and we want to assist them. So if folks need help with data entry, we have a ability to support them, either to get folks to a location to help with data entry, or even to centralize that data entry here at the state level. So we want to support them. And if there are any issues related to CVMS or questions, we have all day office hours, lots of ability for folks to get in touch with us to ask questions, to make sure we're continuing to improve that underlying system itself. It's one of the reasons we wanted to have that system here in North Carolina, so we can continue to make improvements to it as we improve things over time.
Follow-up from Colleen Quigley, WNCN.
Thank you. And one more question. I know you said there are discussions ongoing right now about more of these large-scale sites and the private partnerships. Can you say if any of those conversations are happening for a partnership in the Triangle?
I think conversations like that are happening across the state and including in the Triangle, yes.
Our next question is from Richard Craver with the Winston-Salem Journal.
Hello, Secretary. This is Richard Craver with Winston-Salem Journal. I just wanted to clarify, I'm sure you've already answered the question, but just wanted to clarify, first of all, that there's not going to be a phase 2, 3, and 4 anymore when you mentioned that everyone will be available after what seems to be the final group of 1B. And then I've been asked specifically to ask about where do teachers fit in terms of the priority list now that if everyone's going to be getting it, I guess what would now be phase 2.
Richard, thanks for that. So as you know, we did get additional guidance just 2 days ago from the federal government. We incorporated that guidance, and I think that, you know, their continued advice to us was simplicity and speed, and we agree with that. So we are making sure that our prioritization is very clear right now. Right now, anyone, our vaccine providers can move forward to vaccinate anyone who is 65 and older, or all of our healthcare workers. So that's the group that's going right now, just to be clear. If you are 65 and older, or you are a healthcare worker, it is your time. However, remember that not every place has additional appointments right now. They're still working through their folks who are above the age of 75. So it doesn't mean that today you can go and get your shot. It does mean that providers can move on to that if they are ready. We know that providers are in different stages. We didn't want to hold anyone back at the state level. And again, that's why we're trying to give this guidance today to say if you can and want to run forward with the group that is 65 years and older, and all healthcare workers, that's terrific. You can do that. Next would be our frontline essential workers, and that's what, Richard, where teachers would fit into that group. Those are folks who can't stay home in order to conduct their job. They're with our kids in the classrooms, so they'd be considered frontline essential workers, as would our police, childcare workers, and others. Thank you.
Follow-up from Richard Craver, Winston-Salem Journal.
Secretary, along that same line, when you're talking about extending what is a limited supply of vaccine, how does that going to affect your long-term care facilities? Because I know a considerable amount of effort is going through Walgreens and CVS, but it sounds like a pretty decent amount of the long-term care facilities are still being helped by county health departments. So is this have the situation of setting some kind of different priorities or increasing the bottleneck with such a limited supply of vaccine?
So the long-term care vaccination effort, as you know, Richard, is being handled by our federal government through a partnership with CVS and Walgreens. In order for the state to activate that program, we were required to allocate a certain number of vaccines to that program. To date, we have allocated 160,000 doses of vaccine to that program, and CVS and Walgreens are using that allocation to work through and vaccinate all of the folks in our nursing homes, the residents and the staff, as well as other long-term care settings. We know, however, that not every single long-term care setting signed up for that program. Nearly all did, which is great, and they're going to be working through that program, but not all, which is where our local health departments come through. Additionally, we know there's also turnover at those places. Some folks are entering nursing homes and leaving at different points. And so we know that we're going to have to go back and make sure that we're using other resources that are here at the state level to help folks make sure that they are getting vaccinated. They'll continue to get prioritized as they are some of our most vulnerable, as well as a setting where there is a high risk of exposure. So we'll continue with those efforts.
We'll take our final question today from Laura Lee with Carolina Public Press.
Thank you. Good afternoon, Dr. Cohen. I just want to clarify the decision-making process moving from group to group. So do individual health departments have discretion, both in terms of moving from what was 1A, the healthcare worker group, to the 75 and older group. But now it sounds like potentially they could say, we're sticking with 75 and older, and we're holding off on 65 and older, even though that is under the state new guidance, the next group. So I guess the question is just, do these health directors have the discretion, and how will they know when they have completed, they've hit enough people in that group to move to the next stage?
Thanks, Laura. We are giving flexibility to our vaccine providers. We want to make sure that they aren't held back by the state and that they can run forward in terms of speed, right? So we know that we all share that sense of urgency to get folks vaccinated. So there are some providers we were already hearing from that said, we want to move on to the next group. We incorporated that federal guidance. That next group includes those that are age 65 and above. So those that are ready can do that. But there is discretion at the local level to say, look, we have booked out appointments for a number of weeks for those that are over 75, and they may be able to start taking appointments for 65 and 65 and up, a few weeks down the road. That may be where they are. So we're trying to give them the flexibility to do that. We know that providers are at different points, so I think that flexibility is important so that they can have the speed that they need if they want it at the local level.
It's along the same lines about moving to next phases of distribution. So what I'm hearing is that healthcare or providers will be able to determine when it's time to move to frontline essential workers, and then when it's time to move to the next group, which has subgroups. Will the providers be encouraged or required in those subgroups? I'm talking about people with medical conditions, incarcerated individuals, and those essential workers not yet vaccinated, to go in that order? Or has this new plan now sort of made all of that one large group that health providers can determine we're moving into that phase with all three of these groups?
Thanks for that, Laura. We are trying to simplify how we're both talking about it and for operations on the ground. We got feedback from our providers to say, help us with simplicity and how we communicate this. And so we definitely took that feedback into the simplified way in which we're moving forward. That's why we're focused on all healthcare workers and those 65 and up, trying to be very, very simple about it, and so folks know exactly where we are. We are still wanting to follow prioritization because the supplies are so limited. So we are focused on just that group right now before we move on to the other frontline essential workers. But and we will signal at the state when we think we'll be moving through those other groups. But we did very much, Laura, simplify that so we can communicate it more easily, and also to ease some of the operational complexity at the local level. Again, we're trying for simplicity and speed as we go through this, as well as a focus on equity. And that's what we'll continue to do. We want to get that vaccine out as quickly as possible. But I want to just say again, please remember that our supplies are very limited. Even the progress we're making, we're going to get a lot of vaccine in arms over the next 2 weeks. Even if we vaccinated everyone today with the vaccine we have in the state, we would still be at somewhere like 6% of our entire population, which means we have to do the work we've done all year long, which is wear a mask, stay socially distant, and wash your hands often. That secretarial directive is still in place. Please do stay home and only go out for essential business. Remember, there is a lot of virus here in North Carolina. Please, please protect yourselves, your family, and your communities. Stay well, everyone. Thank you.